A patient today asked about Luvox or fluvoxamine. Fluvoxamine or Luvox is an SSRI or selective serotonin reuptake inhibitor, which results in an increased availability of serotonin between neurons in the synaptic cleft by preventing serotonin from moving backwards into the neuron or nerve cell that it came out of. And Luvox or fluvoxamine, when I think about that medication, it tends to be most specifically in the treatment of OCD. For whatever reason, Luvox is one of your most serotonergic SSRIs, and because of that is one of your most effective SSRIs or medications for the treatment of OCD. OCD and bulimia typically tend to need higher doses of your SSRIs, so when you think about this or conceptualize it, those conditions tend to need higher amounts of serotonin available in order to treat them. So typically higher doses of medications in these categories to treat them. So utilizing Luvox or fluvoxamine, which is one of your more potent SSRIs for increasing availability of serotonin, may be a really great option for some patients out there. Luvox is something that has side effects just like any other antidepressant or SSRI. Most of the side effects that individuals have are pretty transient, so maybe for the first several days or week or so after starting a medication or increasing the dose, someone might say they have a headache, upset stomach, feel a little bit more tired, feel a little bit strange in some way, muscle aches or pains, or if they stand up too quickly, they might feel a little bit lightheaded. These side effects tend to go away over time, and I'll usually tell people to take the medication at night so that you sleep through the majority of these side effects. And then after a week or so, once you get used to the medication and the side effects go away basically for most people, then switch it and take it morning or noon or whatever time makes the most sense for you, where you're least likely to forget to take a dose. Other side effects include an increased risk for bleeding, which for most individuals doesn't tend to be clinically significant. However, if someone does note that they're having increased bruising, or someone has a history of really easy bruising, or a bleeding disorder, or they're on a blood thinner, for example, I'm going to want to talk to their primary care provider or their provider to make sure that it's safe for them to be on this medication and make sure that we can collaborate between visits if needed. SSRIs like Luvox or fluvoxamine also carry a black box warning for suicidality. With that being said, untreated depression is going to be your leading cause of suicide. And so if someone is struggling with depression, my advice is to seek out the treatment from a mental health professional and really discuss options, whether it be medication management, psychotherapy, behavioral changes, or others. Bottom line is though, if someone does have suicidal thoughts on a medication or not, you need to get medical attention immediately. So call 911, get to a local emergency room, have someone be with you, like a local crisis center, and let your providers know that you're having these symptoms to get the treatment that you need and to stay safe. If you believe this video pertained to you in any way, please reach out to a medical or mental health professional to set up an appointment. These videos are meant to be informative only and are not medical advice for any specific person out there.